Westmoreland Community Connections is a presentation of Citizens Fiber.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Jennifer Miele, Chief Communications Officer and Managing Director of Evangelization of the Diocese of Greensburg.
Hello and welcome to Westmoreland Community Connections. I'm your host, Miele. I'm the Chief Communications Officer and Managing Director of Evangelization for the Diocese of Greensburg. Happy to be your host and very happy to have on the show today Dr. Jacob DiCesare and his wife Holly from DiCesare Orthopedic Medicine with multiple locations throughout Westmoreland County. Glad you guys could join us today. I know you have a super busy schedule, but I think what we have to talk about today is very, very important. And before we talk about jumpstarting our health after the holidays, I want to start with the two of you. We'll start with you, Dr. Jake. Tell us where you grew up, where you went to school, a little bit about your education, and how you chose the career path that you're in now.
Yeah, so I grew up in Penn Township, where you grew up. And I went to Greensburg Central Catholic for high school. And then the reason I kind of got into this starts back when I was in high school. When I was younger, I basically used a chiropractor kind of as my primary care doctor, as you will. And I was very interested in musculoskeletal medicine. And I actually have a degree in psychology, and I have a master's degree, as a matter of fact, and I was going to get a PhD. And this kind of goal of doing something musculoskeletal that kind of fell behind when I was in college came back to me. When I saw how much work it actually is to get a PhD in psychology, I thought, man, I should just go to medical school, and I knew what osteopathic medical school was versus the traditional allopathic they have an emphasis on musculoskeletal care. So I went to LECOM in Erie, which is an osteopathic school, and I learned a lot about osteopathic manipulation. And then I did medicine residency at UPMC, and then I did sports medicine at Allegheny General and worked for Excella in the orthopedic department for 10 years and went off on my own in June. And I have my own practice now where I do all musculoskeletal medicine, non-surgical, a lot of ultrasound guided procedures. We do regenerative treatments such as PRP or prolotherapy. And we've been getting busy.
That's amazing. And with you today is your lovely wife, Holly. Holly, tell us about you, where you grew up and what your education is. And now you're helping to run a small business in Westmoreland County.
That's exactly right. So I grew up in the South Hills. I went to Upper St. Clair High School. And then after high school, I went to the University of Maryland for my undergraduate degree in political science. Then I went to the University of Pittsburgh Law School, and I practiced law for about 8 years until we had 3 small children. So now I do that very part-time, but that law degree was helpful in getting our business started and getting us up and moving.
How did you two meet?
We met at a Pitt football game, believe it or not.
Yeah, that's right. Yeah, it was 2006, and I was an intern, and they put me on call that night. However, that was the year that I think Pitt was like 6-1 or 5-1, and Rutgers was coming in, and they were 6-0 or 7-0, and it was the year that Ray Rice played for them. But it was a big deal back then, and this resident came to me and said, hey, do you want to trade Friday for Saturday? And I thought, oh, yeah, I'll do that. And I called my friend and I said, hey, can I get a ticket to come to that game? I know I gave mine up. He said, no. He said, just come. We'll just figure out something,
He had sold your ticket.
He had sold my ticket, but, as I had asked. So I always give Aparna, who was the resident at the time, credit for my marriage and my kids, because if she hadn't traded that Friday for the Saturday, I never would have gone to that Pitt game. Or maybe it's Ray Rice. I don't know that I should credit. But so, I went to the Pitt game because it was considered a big deal. Of course, Pitt lost like 5 games in a row after that. But, I met my wife there, and the rest is history.
That is wonderful. Now you have 3 children, 3 boys. What are their names and how old are they now?
We have Jacob, Jude, and Julian. Jacob will be 9 next month. Jude is 6, and Julian just turned 4 on the 22nd.
Wonderful, wonderful. So you have a lot on your plate. 3 small children, running multiple offices for orthopedic medicine. This is no small task. Would you mind taking us through where your office locations are?
Yeah, sure. Well, first of all, I am in Greensburg. I'm at 438 Pellis Road. There's a lot of medical offices on Pellis Road, and one thing about Pellis Road, I wish that the city would let you put the address out on Pellis Road, because you have to kind of turn in where the State Farm is in order to get back to where we are. Not that it's difficult, but we explain that to everybody. You can see our building from Route 30 there, but when you go on Pellis Road, like I said, you have to go like you're going into the State Farm building. But I'm in the Norwin Hills Shopping Cella, Excella Square, and I'm in the Medical Arts building there. And then I'm also going 2 to 4 days a month to Mount Pleasant. Dr. Rachel Esposito had asked if I would come out there into her office to serve that population so that they didn't have to drive into Greensburg or wherever to get care. And that's been very lovely. So we're in those 3 locations here in the county.
And that is very good locations for people in Westmoreland County who are looking for orthopedic care. What would you say the population is like here in Western Pennsylvania? Certainly a lot of people of age who are probably trying to avoid surgery who are coming to you. Is that a lot of the patients that you see?
Well, we get, kind of all ages. Obviously, the sports thing isn't working out so well here because of coronavirus, but, we still see some athletes, but, it's unfortunately they don't get to play as much as they would like. And so I would say that in a typical year, we probably see more athletes, if they were playing. But you're right. I mean, most of my visits are patients who have, osteoarthritic type conditions, and those are chronic conditions. So we see them more frequently. And, it's a lovely population. I always feel like I'm related to everybody that I see, as a matter of fact, 'cause everyone reminds me of my family members. I think that's just from growing up in Westmoreland County. And it's just the kind of flavor here, as everyone kind of acts like family, And that's what we try to do really in our offices. Right. Is, if you're one of our patients, it's kind of like a more family environment. It's like you're kind of more treated like your family.
I think that's most of the feedback too that we've gotten, Jen, is that, patients who have followed us, for whom we're so grateful, tend to leave reviews and tend to tell us things like, we feel like we're treated like family. We're treated so well. So it's like, when you have a problem and you need to be seen today or tomorrow because you're in so much pain, the girls make every effort to get you on the schedule today or tomorrow. And Jacob never has a problem staying late or fitting someone in, or even on a Sunday, he's seen people. So it's a lot more personalized care, I think. And I think
you went on the radio and told people that you would come in on Sundays if they call.
I know. I was listening to her say that.
But that is the value of running a small family business. I think that's
exactly right. And we need to too give credit to our office members, because we have Tracy, we have Ashley, and we have Christina, all of whom came with us. And this would never work without their help. Yeah,
and they're all locals, and they understand people from around here.
They do. Yeah, they're phenomenal.
Yeah. Yeah. And that's, I think that's the benefit of being an independent practice versus being an Allegheny UPMC or Excella, is you're run by people who are from here, and they understand this population. We're not trying to be the Cleveland Clinic. We're trying to be DiCesare Orthopedic Medicine, some of those businesses, I feel like they're trying to be the Olive Garden and we're trying to be Rizzo's,
Yeah.
So, so I think we got a leg up there,
Oh, that's great. That's fantastic. And, part of trying to help the population in Western Pennsylvania is trying things before surgery. And that's a lot of what you do and a lot of what you have to offer. Isn't that right?
Well, that's definitely true. I'm definitely not pushing surgery on anybody, but I do have other alternatives to try and, if you have a bad knee, that's, the kind of probably the most common issue that we see. Your knee isn't what it once was, and the goal is to try to make it perform as good as it can be. So that's kind of what my career is dedicated to. And I think, if you go to see an orthopedic surgeon, the tools in their bag is surgery. So if you need surgery, that's an excellent place to go. If you don't, you can get some things there, but you're probably not going to get all the different options. And which is why they send them to me. I still work very well with Excel Orthopedics. Those are all my friends, and Allegheny too. I mean, I train there, and so I get a lot of referrals from them for this kind of in-between care, and we work very well together. But I got to tell you, there are people that they need joint replacements, and they need knee arthroscopy. I'm not one of these people that says that you don't need surgery. I mean, people benefit from surgery, and if they need it, I know where to find it. I know who to contact.
And that's a really important indicator. I was noticing very good social media, very nice website. And on both of those elements, we talk about the gentle injection. Mm-hmm. Can you explain that to people at home who may be having, just their first bout with a knee problem or an elbow problem or a shoulder problem?
Yes. I mean, there's several things I think that make it so that patients have a bad experience sometimes. One is that they may have gotten an injection from somebody who doesn't do it all day, right? I mean, this is a big part of my day, so I have a lot of experience with it. And even if they do see someone who does a lot of injections, like an orthopedic surgeon, some of them have a different technique than I do. It's kind of a technique that I've developed because of my background in prolotherapy and in PRP, where you do a lot of injections. And I became an instructor nationally and internationally for prolotherapy injections, PRP injections, musculoskeletal ultrasound. And basically, my approach is I use smaller gauge needles, which means I have to use my wrist more and my thumb. And so the smaller gauge means they're thin. And I start injecting lidocaine right away as soon as I hit the skin. And I only use one needle, not two. So when you start pressing the lidocaine, when you hit the skin, you're doing two things. You're pushing the tissue away from the needle so it's not getting stabbed, and then you're numbing the tissue in front of you. So, and I only use one needle. I don't use two. A lot of people, they get one numbing needle and then they get a second one and they say, well, why did I get two shots? And they don't like that as much. So I've been teaching family medicine residents at Washington, and they're all pretty impressed by that technique as well. I've been trying to share that with them. But and I just started getting a lot of comments from patients, things like, hey, if you're afraid to be injected, if you're afraid of getting a knee injection or shoulder injection, have no fear. I mean, this guy here, I didn't even know he did it, so that's where I kind of came up with that. That was me that came up with that gentle injector idea, because that's important to people.
Right. I think too, Jacob, one thing you should mention is precision, because Jen, one of the first things we bought when we went into this business was the ultrasound. And mm-hmm. He mentioned that he's an instructor for ultrasound guided. You're going to have to explain that better than I can.
Well, yeah, that's true. I've done some instructing for ultrasound. So I do musculoskeletal ultrasound. I have an ultrasound that I bought that's a high-end ultrasound. Now, yeah, so that's what I was going to say. Is it looks like kind of a big laptop, and you can open it up, but it's more powerful than the big-looking ones that you might see in an office somewhere, or like the one I used to have. But so I'm able to look and see. If I'm doing a shoulder injection that's in the ball and socket joint, I can see the cartilage on your glenoid. I can see the joint capsule and I can slip it right between those two layers and put the medicine where it needs to go without injuring you, without skewering your cartilage.
Wow. And we are talking about technology now with Dr. Jacob DiCesare and his wife, Holly, from DiCesare Orthopedic Sports Medicine. My name is Jennifer Miele, and I'm your host of Westmoreland Community Connections.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of Citizens Fiber.
Welcome back to Westmoreland Community Connections. My name's Jennifer Miele. Happy to be your host. I'm the Chief Communications Officer for the Diocese of Greensburg and the Managing Director of Evangelization. I am joined today by two very special guests, Dr. Jacob DiCesare and his wife, Holly, from DiCesare Orthopedic Sports Medicine. DiCesare Orthopedic Sports Medicine has 3 locations in Westmoreland County: Greensburg, Norwin, and Mount Pleasant. Today, both of them are joining us to talk a little bit about the role technology plays in orthopedic medicine. We were just discussing the gentle injector, the ultrasound guided injections, and the end game here is to assist with pain, right? People who are suffering out there and they need some relief on that. And that's what you've been able to do for hundreds, if not thousands of people, I guess, in Western Pennsylvania, Dr. Jake.
Yeah, that's correct. As I said, it's not always just about pain relief. It's kind of about function too. I always, like I had mentioned before, I want to make the patient be the best that they can be, from a functional standpoint, from pain, from being able to do the activities they want to do. So that's kind of the goal.
And a lot of what we wanted to talk about today were a few questions about sort of getting back in the game after the holidays. I mean, let's think about it. Right? The holidays here, we're eating too much, we're drinking too much, we're probably not exercising enough, and then we find ourselves on the low end of functionality when it comes to physical health, and have to really try to jumpstart our health after the holidays. What, in your experience, have you seen after the holidays? Do you see injuries? Do you see soreness when people try to get back in the game and try to get back into their health? And what advice do you have for those people who are trying to jumpstart their health after the holidays?
Well, you see weight gain. I don't know if you see injuries. I'll tell you when you see injuries is when someone has a wedding. Because I'm serious, because everyone comes in and they say, oh, I was dancing at the wedding, and then they injured their knee. But so I think in the old days when people had big Christmas parties and people danced, polka or whatever, or that probably would have been true. But, you definitely see a lot of weight gain. I think regarding the weight gain thing, that the biggest thing is it can be hard to lose weight, but it can be somewhat easier to become kind of fit. And, your fitness is more like your cardiovascular ability to be able to do activities. So I think that step one is really to get your 150 minutes a week of low impact cardio in, I don't, for people with bad knee osteoarthritis, you don't want to do, running and jogging, but using an exercise bike or an elliptical, walking, if you can do that 20 to 30 minutes a day, or, you can make that into, 40 minutes 3 times a week. And you want to get up to 150 minutes a week of aerobic activity. And aerobic activity is not like Jane Fonda type stuff. That just means you're getting your heart rate up to 70% of your maximum. So for most people, if you're able to take your own pulse on your neck, if you can get up to, 100, 120, something like that beats per minute, that's sufficient cardiac activity that you could do 150 minutes a week. And it's at least a lot more palatable to do that than to say, don't eat cookies, which you shouldn't do that either. But, it's a lot easier even if you sit in front of the television and you do your exercise equipment. I also think that yoga and Pilates is an excellent exercise form. And the reason that is that, people, when they do quote unquote core exercises, they want to do abdominal crunches and ignore, their back muscles or the little intrinsic muscles right around their spine. So when you do yoga or Pilates and you get into those positions, the only way you can maintain those positions is by your those tiny little muscles that you don't have a lot of control over that have to engage to keep you balanced. So those are two big things I recommend, regarding fitness.
Those are excellent recommendations from Dr. Jacob DiCesare. Also joining him today is his wife, Holly, from DiCesare Orthopedic Sports Medicine. And we're talking about jumpstarting your health after the holidays. And he just recommended 150 minutes a week of low impact cardiovascular activity. I was adding mine up, and I don't know if I'm going to make it this week. But now that you tell me, I think that's a good rule of thumb to set for sure. So, Holly, I'm going to turn to you for just a minute. And we talked about the different office locations. If people are having pain or their functionality isn't what it used to be in terms of their orthopedic health, your job to some extent has been to set up some of the offices, particularly the Norwin location, which is located in Norwin Hills Shopping Center. And so if I am having some mobility issues, what is the parking like? Is it easy to get in and out of? Can you tell us a little bit about the office or the offices?
Yeah. You know what? The accessibility is really easy at all of them. Pellis Road, you walk straight in, the door is on the right, and there's a big waiting room waiting for you. We do limit our patients per hour, and we do space the waiting room. We obviously clean it thoroughly. Mount Pleasant, you walk straight in. It's the same setup. No steps, easy parking. And Norwin is the same. Norwin, you walk down a little hallway and we're on the left.
That's great. So if they are having some issues, it shouldn't be too bad to try to get in the door to do that. So how do you make an appointment with DiCesare Orthopedic Sports Medicine? How does that happen?
So we just rolled out an online platform where if you're on our website, you can actually request an appointment from the website. We have people request appointments on Facebook, believe it or not. And then there's always the good old-fashioned phone call where we would be happy to assist you.
Yeah, and the number is 724-261-4080.
So there's an opportunity to connect with DiCesare Orthopedic Sports Medicine, which is very helpful. Also getting some tips about jumpstarting your health after the holidays. Of course, eating and drinking and all of the fun things that we do, there are consequences for that later. So Dr. DiCesare is recommending that lengthy 150 minutes of cardiovascular exercise each week, but that's something that can get people on the right path to health. So Jake, tell me about, when you see someone, I know you've seen some of my family members and things like that, people who are in their 20s are having orthopedic injuries, people in their 70s are having orthopedic injuries, but knowing what you know and what you've studied beyond exercise and eating well, I think what you started to talk about just a few minutes ago was the yoga and the small muscles and the stretching. Do you see people with greater mobility the longer they live who do these kinds of activities, who are in yoga, who are taking care of themselves? And have you seen any secret sauce, any secret recipes?
Well, I mean, if you're talking about the population that's 70 and over, they don't have to do yoga, it's for them to look a lot better than the other 70-year-olds that do nothing. Okay. We have people in their 70s that do lots of things. They maybe they lift weights, or maybe they're into, playing tennis or pickleball. And in general, I think if you're getting those 150 minutes a week, you're probably going to be doing a lot better than the people who aren't doing that. But yes, I mean, people who have who are dedicated to something like yoga, they do exceptionally well with balance, which is a difficult problem as people get older, with doing things like getting up and down steps or going from sitting to standing. So I think that the aerobic activity is the first key. And then the second is if you can do those core strengthening type activities that that incorporate balance. That's very important, like Tai Chi as well. Not that we see a lot of people who do Tai Chi. It's more yoga,
Excellent. Excellent. This is great. We've been talking with Dr. Jacob DiCesare and his wife, Holly, from DiCesare Orthopedic Sports Medicine. We've gone over career history, how the two met, starting a small business in Westmoreland County, now up to 3 locations for DiCesare Orthopedic Sports Medicine, Greensburg, Norwin, and Mount Pleasant. So we've had a great discussion about jumpstarting your health after the holidays. I certainly know I've gotten my instructions, I've gotten my orders, and I'm very, very thankful for those orders. I'm thankful for the two of you for jumping on today to Westmoreland Community Connections on WHJB. So one more time, if folks out there are interested in making an appointment, can you give us the number and the website?
Sure. The website is greensburgortho.com and the phone number is 724-261-4080.
Wonderful. You two are involved so much in the community in Greensburg. We thank you for all of your support. I know, the fundraising that you do for the local Catholic school, Aquinas Academy, is greatly appreciated by everyone involved. I know you just finished your first virtual fundraiser, and we're very grateful. I'm sure every dollar is going to support the children at that school. Wonderful couple and wonderful doctor. Thank you, Dr. DiCesare. Thank you, Holly. And if you have any questions for them both, available on our Facebook and website. You're listening to Westmoreland Community Connections, and I'm your host, Jennifer Miele. Thanks for joining us.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of Citizens Fiber.